Artificial intelligence is rapidly reshaping industries right around the world, and healthcare fast finding itself right at the centre of the shift from clinical decision making to wearables that are changing patient interactions. AI is starting to play a much bigger role in how care is being delivered. Let's bring in Dr. Stephen Barnett, co-founder of MedLuma. Great to see you once again, Dr. Barnett. Talk to us about the big picture here. There's so much hype around AI, but in practical terms, how's it actually, I guess, changing day-to-day realities?
Yeah, thanks, Ahron. Look, AI has made a huge impact already in healthcare. I've been in the game for a while, and seeing the uptake of this technology is one of the fastest things I've seen. In terms of day-to-day practice for clinicians, it's really started out with workflow, so the things like scribes and helping take your notes and documentation. But the bit we're excited about is the new cresting wave is actually trusted knowledge in healthcare using AI, and that's really a game changer for us.
What does that actually mean? How are they using trusted knowledge for AI?
So usually you have a massive number of knowledge sources you're trying to keep up to date. There's a exploding medical knowledge, and a million new articles published every year. Patients have got an exploding amount of knowledge from other, social media and so on. And to try and actually synthesize all that into the right information for the right person at the right time is a struggle with traditional documents and guidelines and hundreds of pages. AI allows you to search through that and find that right information at the right time in a safe manner if you're using a government system.
Yeah, so with all of this change and I guess reliance and use of AI, talk to us about misinformation and AI hallucinations here that should be concerned about, because as you mentioned, using it with the patient data, etc. I mean, we all have had our experiences with AI and say, how on earth did it come up with that? How concerned should we be about this?
Look, I think there are huge opportunities and there is significant risk. And so it's actually pretty easy to do now to get answers in healthcare. It's actually hard to do it well. So trust and quality and actually managing that information in a safe way is super important. So yeah, hallucinations do happen. We all know that the standard AI engines make things up. They want to be confident, they want to help you. And we see that in articles published in Nature recently, where only 50% of emergency presentations were picked up appropriately by the AI. So
wow.
That is a worry.
Yes, I love the term confidently getting things wrong. It looks you in the eye and says, here's the perfect answer. And if you know that it's wrong and you put it back, it will come back with, you're right, that's on me. And it's like, well, yeah, it's great, but how does that help? Now, you've been on the show before on Ticker, obviously talking about your new platform, MedLuma. How does something like this fit into a landscape, particularly around trust, credibility and verification?
Yeah, so effectively what we've focused on is that quality and safety and trust and building medical grade AI. So just like you can get a good bit of like a chisel is often what's used in orthopedic surgery. You can get one from Bunnings for $30, but if you actually want the orthopedic surgery chisel, it's going to be validated and weighted and safe to use in surgery. They look quite similar though.
Yeah, great to know. If I ever decide to set up my own surgery, I can just pop down to Bunnings to give me a hand. But obviously, I guess the point you're making is about having a program which is fit for purpose.
Absolutely. So things can look similar, but there's a huge amount in the difference between the Bunnings chisel and the orthopedic surgery chisel. It's been validated and is safe for use in the medical industry. And
yeah, so from a clinician's perspective, I guess, why do you see this as making the biggest day-to-day difference?
Because clinicians in healthcare, and as a patient, if you're sitting there, near enough isn't good enough. So you need a good, safe answer. And so it's that last mile where we're kind of really working hard, making sure that the information is validated, curate the data source, have all the guidelines, and have then humans in the loop in the background doing validations to make sure that we're comfortable that hallucinations and all of those other issues are managed. And then ultimately, the clinician can make their own choice because everything is referenced back to a data source that they can click through to, as opposed to we've probably all seen, oh yeah, and here's the reference, and you've got to click it, and it actually isn't even there.
Yeah, talk to us about, I guess, the industry adopting and adapting in terms of AI. Where do you believe organisations like the AMA, the Medical Association, actually fit into this? Do they need to have more structure and standards in the face of international players?
Look, I think it's important that across healthcare we come to some agreement around what is safe and what's the best way to use this information. So I think part of that's education, part of that is making sure that as clinicians and users, we know where this can be used safely. And then I think it's making sure that there are some obvious ways of understanding, is this tool a safe one to use? Because there are lots of them out there.
Yeah, before we go, where can people find out more from you guys?
Yeah, so MedLuma.ai, that's our platform for safe medical grade AI.
All right, Dr. Stephen Barnett, really appreciate your time as always on Ticker. Thank you.
Thanks, Ahron.